Just welcoming everyone. Thanks for responding to my emails, y'all, and registering. And I'm really looking forward to seeing what this is all about. And we'll be sure to send out the recording afterwards for those who couldn't attend today. I know there was a lot of interest.
Wonderful, wonderful.
All right. Back in, Kate, you're coming in now. And Karen.
Okay, 1 minute countdown. 5 minutes, that's as patient as I can be.
And what part of Oregon are you in?
Was that a question for me?
Yes, ma'am.
I'm in Portland area.
Nice, very nice.
But I see we have folks here from all over, which is great.
Wonderful. Wonderful, wonderful. All right, Mr. Cassell.
Excellent, excellent. Well, we are 5 minutes after the hour, so we'll jump in and get started. We are recording this, so as Hannah mentioned, we'll be distributing it out to everybody and anybody that wasn't able to make it today. Just by way of introduction, my name is Lance Cassell with WellCheck, also joined by Chris Nickerson and Darlene Mitchell from the WellCheck team. What we're going to be doing today is just taking a couple minutes. I'm going to just give you a little background on us, and then I'm going to turn it over to Chris for just a quick demo of what the digital enrollment platform looks like. There'll be opportunity at the end to ask any questions you have, but if anything comes to mind during the presentation, feel free to put it in chat, and I will moderate that and make sure that everything gets answered here before we break for the day. So diving right in. As I mentioned, WellCheck is the name of our organization. We are based out of Baltimore, Maryland. Originally, this platform was conceptualized by a school teacher inside a school outside of Baltimore. The original impetus for the platform was to enable accountability in the event of a emergency notification, creating a two-way communication via email and text message. That's originally what it launched as in 2015. As the program evolved, Chris and I and Darlene got involved and saw an application not just inside of schools, but outside, working in healthcare and also local health departments. We took our platform, made it HIPAA compliant, and then prior to COVID, our platform was being used by healthcare organizations as a way to do annual wellness visits. Then COVID happened, so began using our platform to do the COVID wellness screening, vaccination card collection, and that sort of thing. Over the past couple of years, we've been working with local health departments, schools, and healthcare organizations in various states around the country. School-based health centers over the past year have been a big focus of ours. We were approached by one of our health department directors who had just opened two school-based health centers in her county, and just really thought that there was an opportunity to garner more utilization by digitizing this process and taking it from PDFs and paper forms and digitizing that. So that's what we've done. We have the ability to map your enrollment workflow and take it from the paper PDF side to a digital version of that, and are ready to show that and all that comes along with that. Gathering that data, everything's time date stamped. There's a dashboard that you can track, see everything that's going on, consent. And I'll dive in and Chris will walk you through what the platform looks like. A couple of the capabilities of the platform, like I mentioned, anything can be tied to a QR code. We also have direct URLs to it. The digital consent side of things, digital medication forms, collection, upload, and storage of insurance cards. And I know Chris will hit on a number of these things. This HIPAA compliant mass communication platform. So basically, once everybody gets into this thing, gets up and running, you have the ability to broadcast out information about, vaccination clinics or reminders to get certain things done. The ability to collect information, throughout the school year, throughout the process. Those are just some of the capabilities, but I'll kick it over to Chris, and Chris, feel free to take it from here.
Thank you, Lance. I appreciate it.
Welcome.
I'll take away your screen share. How about that?
I figured it would happen at some point.
Matter of time. So, yeah, as Lance shared, and I'll make this a little bit bigger for everybody. During the pandemic, and I'll just highlight a short moment in time in our history. During the pandemic, we worked really closely with the local health departments, and through that partnership, through that collaboration, we found ourselves really working with them to fill those gaps in technology throughout, you name it. Registration for vaccinations, for registration platforms. We built a digital referral system for one of our community health partners. Infectious disease reporting capability, and really what think of our platform is a very beefy system that during the pandemic we were sending out to health departments, school systems, companies, organizations, about 1.2 million daily text messages, and all 50 states and 7 countries. So we've got this it's built on the back of HIPAA compliant AWS system. So it's a web-based platform, cloud-based, HIPAA compliant, and simply put, we can take any paper process, any manual process, and digitize it. And that's where we have found a need, as Lance mentioned. One of our health officers opened up 2 school-based health centers, and she had the packet of paper still sitting on her counter after a month. And she's like, "Hey, can you help us with this enrollment? It's a barrier to entry. We need this translated in multiple different languages. It's too complex, and it's just slowing down the process. And we just opened this up, and we need to drive enrollments, and we do need to drive awareness, and we need to get people into these centers. And never mind the fact that if a kid comes in and needs to be seen, then the parent would have to leave work and come in and sign the paperwork and that sort of thing. So that is really where all of this was born and built and created. And as we've got into this more and more and working with more and more of the state partners, everybody on this call, on the WellCheck team, we have kids in elementary, high school, middle school, so we know the forms that we filled out, and why not find use technology and leverage technology to help and provide that process, so the folks on this call can get back to doing what they do best and providing such that great care to the kids. That is really what we're a technology partner. We love building and personalizing these workflows for you, and gathering all the pieces of information that along the way. And as Lance said, time, date, stamp. So I'm going to share a little template. We have it broken up into different sections. I hope everybody can see my screen. This first section is the demographic screen. So think of this as your registration form and gathering all the needed demographics for each of the the paper form that you have and taking here's a little sample. I mean, I don't need to share. I mean, we all have them, right? And taking this and capturing this and putting onto a digital platform here. We can separate it by schools, locations. So we're gathering that information and it can be siloed. So that way, if you have multiple different administrators handling specific schools, it can be partitioned out. In this particular case, we also, the next screen then is the insurance side of things, gathering information on the insurance side of things, right? And what this platform can do is it can take copies of insurance cards. It can allow folks to input this in. I mean, probably everybody on this phone has tried to transcribe handwriting, and no offense, Mr. Lance, but his handwriting's terrible. So I would never want to read what numbers he's trying to put in there. But this can, autofill. You can make required fields. You can gather information. You can also, our system has the ability in a lot of our health centers, I don't have health insurance, and then redirect them to other services that are available in the community, automatic notifications, a number of different things that, and access to other services in the community. So this is the insurance section. We have the ability to capture that. Everything is time date stamped. Every individual data point on this journey here is captured, trackable, and searchable. Now, where our system is, and I'll pause for a second there, is our system lives, where does our system live in this whole process? We have some school-based health centers where we are the repository. We gather it, it lives there, it's web-based, it's accessible 24/7. We don't charge by administrator. As many people can have access to this. The information's yours. We're just the protector and the proprietor and the keeper of it. So that's one resting spot. Another is we push this information to other EHR systems. So after it's been collected, we have the ability to share this information with other EHRs in a synchronous way there. So enrollment consent section. So a lot of our school-based health partners are obviously the key piece of this to provide care is to get that enrollment consent piece of it. This information can be captured pre-populated, so you don't have to keep filling out the name over and over again. It can pull the information from prior screens. We can also elect to receive additional digital communication from a healthcare team, digital signatures and alike. This then leads into next journey. Again, this is just for templated. It all can be customized. It can be moved in different ways. Gathering some of the health history and family history from any connected device, from your mobile phone, from an iPad, a computer. As Lance said, it can live behind a QR code. It can be embedded on the website. I know a lot of the websites have click here to download the PDF and bring it in. That could be replaced with a link that can go right into this, and the enrollment process can be started right from the desktop. We have the ability to take other different consents, disclosures, financial. Some of our school-based health centers offer dental, so any information about the dental pieces and parts, get a confirmation screen, and then obviously a email confirmation goes out to the individual that is then a part of the process. Multiple different guardians. We can ask, who else would be bringing can sign. There's an attestation for if you have that guardianship and all that stuff. So simply put, this is just 30,000 foot of what a basic enrollment process would look like. Essentially taking all these pieces, and part of our process is, candidly, we take this and then any of the required fields that are must have in order to deem as a complete enrollment are then marked as required. and the individual cannot complete the enrollment until until those are checked. So another we've seen paper applications come back without missing information, and then you got to follow up, and you're wasting a lot of valuable time that otherwise could be giving care to the kids, the ultimate charter here. So we also have the ability to partition this out, right? Some of our partners are like, you know what, my most important thing is get this enrollment consent. I'll gather the family history. I'll grab the medical history at another time, or I'll send that out as a follow-up. But the enrollments are most important. We can parse that apart and have two different phases, if you will, two different screeners. Kristen said, sorry, I'm just seeing the chat. I was in a private practice platform called Frisia. This sounds similar. Is this correct? Lance, I'm not familiar with that group. But if they were digitizing the enrollment piece of it, where we found is a lot of the HRs are, once they're a patient, that's where the patient records are, but not a lot of technology out there to really support the enrollment piece, the original piece. There is all of this information lives on this platform that I'm about to share with you. Everything's downloadable. This is what the link would look like. And again, this would live on a embedded website, QR code, can go out on a text message, email blast, any and all of that. The ability to select your English, preference. We found a lot of the school-based health centers we work with, we're bringing in translators to fill out the forms. Beautiful part about our system is if it's captured in Spanish, it's then translated back into English on the administrative side. So that way you don't need two translations to happen. But this is the platform, and it lives on this dashboard that is accessible 24/7. And just show you a couple screens here. In this particular sample, this school-based health center does have access to non-students. And that process is obviously, if you're over 18, you can consent for yourself. So the consent is a little bit different than having a parent or guardian consent for you. And here's some of the basic pieces, parts of the enrollment that of the registration application, attestation here. Again, everything's time date stamped. And another beautiful part about the consents that we enjoy is that we can also have them ultimately live on existing consent forms that you've and I'll share you. So this is St. Mary's County Health Department. This is the consent. We gathered these pieces of information, and it lives on that consent that's in a PDF that you can store, ultimately living in the EHR system. I know that, especially in split households, having that time date stamp of that consent for that treatment is key. And so we have the ability to populate existing forms as well. If that is how it needs it to finally be in that state. One more feature that I'd like to share here is also the broadcast side. So we, as Lance mentioned, the original school teacher, Sarah Maggi, who's still very part of our organization, broadcasting two-way notification is very much a part of that. Announcements of different events and different programs are also able to take place on our platform. How would this be addressed in a form? So this is just a sample of the a flyer that is being sent out to the program. So on to Hannah's question. In Oregon, for our ages of consent vary: 14 for mental health, 15 for oral, medical, and any age for reproductive health. How would this be addressed on the forms? We have the ability to, can be handled a number of different ways. We can base it off of the birth date, right? We can build logic in there that the system could figure out exactly after the birth date is entered into the system what this individual is eligible for parent consent or self-consent, right? So there's a track and there's logic that can be built into that based on the different service lines, for sure. Again, you said any age for reproductive health. If that can be its own separate track where, hey, I'm here to see and I want to consent on my own behalf for reproductive health. You can gather that information from the student and have that there in our system. So that is very much about what the platform is capable of, and we would build that logic in, and we call it branching. So based on that, how you would want to, if you'd want to have that service on the front end, meaning the fork or the branch, hey, I'm here for mental health services, I'm here for oral, medical, or I'm here for reproductive, and then it could go to the next screen and say, hey, based on your birth date, we're going to need parental consent, or based on your birth date, there is no parental consent needed, please proceed. And then the individual, the student, would be able to consent on their own behalf versus having the parent. And both of that could be happening simultaneously, right? I mean, we could, in theory, if you wanted to have the parental consent for all the services, globally, and then individually, the student could consent on their behalf for their own. Some of the other ongoing capabilities is that each school year, right? I mean, after they get past 14, maybe there is another broadcast out that, hey, you're of age now that, hear consent on your own, or vice versa. I mean, it really is how we gather that is really, we would mirror how that's in place right now. So from a technology perspective, it's very much a part of what we do here. So Lance, all of this, before I turn this over, all of this is downloadable. You can search, you can run real-time reports. Everything's time date stamped, demographics. We can even build custom dashboards for reporting purposes to look at trends and all that. But it's important to note that all of this information is accessible not only through this web-based console, but also downloadable at any time. And it lives in the file center. So this is accessible for you and your team. It lives here and can be pulled out at any time. Lastly, before I open it up for questions, there's also a grouping capability in the platform that for those folks that elect for digital communication, we can create different groups for age groups, grade groups, school groups, those sort of things for upcoming events and notifications. That's more of a grouping capability on the mass notification side of things. So just thought I'd point that out. But what we're here to talk about today, more importantly, is how can we save time, energy, minimize the mistakes, take that paper form and shorten and compress that time. Johnny puts it in his book bag and takes it home, and I'm lucky to get my middle schooler to get that to the house and get that filled out, and luckily to get it back into the school system. Compressing that time, getting those enrollments, getting that consent, and protecting you and your faculty in that process. Like I said, everything's time date stamped, so there is a log of all the activity and that. So, with that, I'll take a pause here. And Lance, did I cover everything? Do I need to expand upon, or do we open it up for question?
No, I think you did a good job covering the gist of it. Does anybody have any questions at this time? Feel free to ask. If we want to, good question, Tricia. If we want to send data to our EHR, will that mean it is in both our EHR and your platform? When the registration data is completed and flows to the EHR, will it attempt a match for existing clients? Can it create a new client in the EHR? For the consent forms, do they create a document? Can you map to a section in the chart?
That's a great question, and we do that currently. We can write a script. The most recent project we were working on with CureMD, we can write a script that actually, and the script takes the existing records in the EHR, bounces against the new enrollments, right? Because the last thing you want to do is have duplicate records in your EHR. That'd be the worst thing. Run a script based on certain criteria, last name, date of birth, any of those criteria, and we are able to, any of the delta can be then loaded into the EHR as a new record. And also to your consent forms, yes, we can create the consent form. The PDF can come along with it. Now, where it lives in your EHR, it varies. We've seen some of them have sections for consent. Some of the EHRs have it living in miscellaneous. Some of them have it living in additional documents. It really depends on which EHR your system you're using. But the simple answer is that mapping protocol is relatively simple. Once we know the fields and the columns and map it, then the script can run daily. One of our biggest clients, New York Presbyterian, we ingest 70,000 records on a daily basis, nightly basis of all their employee records, and we run the scripts into deltas, and then we update that into our system. So very, very capable. Have you done this mapping protocol with Epic? I know we've done it with Cerner. I know we've done it with CureMD. I am going to have to check, Lance. Have we done it with Epic yet?
No, we have not gone live with Epic, but we are working with some clients now. We're working through that. So soon, very soon.
Kristen, the dreaded question. Whoa.
It is dreaded.
What's not dreaded?
Just kidding.
What are you talking about? All right, you want to take it?
Sure.
To complete prior to a visit. Can you push screeners to a patient? Sorry, I'm just going through Kristen's questions. I like the questions. Can you push screeners to a patient prior to a visit? Absolutely. Yes. We have the capability to ingest CSV file. So if you have email addresses that you had prior to, and you wanted to load them in the system and then push out this link to the screener ahead of time. Yep. The other thing that, and I'm remiss to didn't cover, and I guess we didn't go that far into deck. We also do on the mental health side, we have the capability, and we've done this PHQ2, PHQ9 mental health screeners as well for on the behavioral health side. So digitizing those social determinants of health is a big one as well, that we're doing a lot of work with assessing that for the kids, and different languages, different reading levels, taking those social determinants of health and assessing that in real time as well. So Mr. Lance?
Yeah, I can handle the pricing question. So there's two aspects of the pricing for the platform. There's a setup fee, so it's a one-time setup fee that allows us to grab your enrollment form, and build a digitized version of that. So the setup fee is $595 one time. That's not annual. That's not, periodic. It's just a one-time fee. And then there's a monthly subscription of $495 per month. And that is unlimited sites, unlimited administrators, unlimited students. So it's not transactional like DocuSign or some of the others out there. And then Chris, you mentioned the additional screeners, ACEs and PHQ2, PHQ9. If you wanted to add one of those assessments, one of those screeners, as we call it, there would just be a one-time fee of $295. And that same monthly stays in place. There's nothing additional per month. It's just that upfront to do the additional screener. So looks like Chris is showing us a version of a PHQ2, PHQ9. Same setup where it'd be tied to a QR code, could be tied to a URL, could be pushed out via email, via text message, and that student could be taking it on their phone, and prior to treatment, during treatment, and post treatment. So that is the pricing. It wasn't too dreaded, right? The feedback we get is that it's budget friendly. We were built in schools for schools, so we want to make sure that as many kids have access to this as possible. So that's why we price it that way.
Sorry, I'm going to ask one more question, and I'm not going to type it in. So with the interface, so it sounds like there is a potentiality with the interface with Epic. You're trying that out with the two, and fortunately, I'm glad I'm not the only one on this call that is an OCHA and Epic. So that isn't an extra fee to do that interface that potentially could help migrate that information into that system?
No, and that's the mapping piece of it. Now, if there's any customization of that, then it gets a little, if we're writing any code to customize that. But the mapping process, we use a number of different things: secure file transfer. We use a Fire API. A number of different ways to share data, and we've gotten really good at it. So what we've seen, obviously, post-pandemic, a lot more those years of those siloed records are going away. So being able to map that and follow those protocols are something that we're very, very, very capable of doing, and that's why we don't charge for that. Now, if there's custom scripts and craziness that we got to do, then yeah, but the simple mapping, no. Great question.
Yeah, and we haven't run into that on any of the other data mapping projects we've done for any of the other EHRs. So I don't foresee that being an issue with Epic by any means. Great questions.
I kind of wanted to make a statement, not really a question, but just saying that I'm glad too that there's other OCHA Epic members on, and maybe this is something we can work with OCHA as a whole, because it is a collaboration, to see how to get those things best designed for certain workflows, in general. Each clinic that works with OCHA and Epic is obviously very, very different, but there could be some, things that are only the same, like the mapping to the chart, or because we use electronic consents for some things, but then there's also documents, like you were saying, mapped to a certain place in the chart. So this is great. Do we have any idea when you might be working with Epic? I know you said soon, but I know our school health centers are anxious for it here in Multnomah County. So
yeah, I mean, that's this is I know, as Lance mentioned, we're working with them. I mean, this, we I guess how do I say this is that this also, the urgency also helps. I mean, schools are opening back up again. Being able to get let me just put it this way. It's not us holding up the process, right? I mean, Ogen Epic, if you got a good contact there and willing to help us with that mapping process, then by all means, especially strength in numbers too, right? Like, hey, we really want to get this map, then we've seen that happen too, where a lot of the local health departments, school-based health centers will get together and, hey, we want this mapping exercise complete. Great. Responsive, we get on the call, we get our dev team on there, we map this out, and once we figure out those fields, it's very, very simple after that.
Excellent. Are there any other questions at this point?
Yeah, actually, I have another one. So this was awesome. I'm super excited about this. So when is this recording going to be available so I can get it in front of our EHR team? And then if next steps of wanting to set something up with you, how do we do that?
Good question. So I'd like to combine the recordings into one recording, because I know we've got a two-part,
Right.
and then it could be made available as soon as, later on today, tomorrow morning at the latest, so I can get that out. I'm going to send it to Hannah, and then I can send it to you as well, Elise. And what was the second part of your question? Sorry.
Next steps.
The second part
Next
yes.
is how do we set up, now that I saw actually our forms on your recording, I'm like, oh, well, that's interesting. But yeah, honestly, I'd love to get you, this has been a wish and a dream of mine for too many years, and I'd love to get this rolling as we have 19 sites. So
Great. Well, I can send you an email right after this call, so then you have my information and we can jump on another Zoom as early as tomorrow or whenever you want to talk about it again.
Okay, great. Thanks.
Sure.
All right, I have yet another question. I figure I'll ask verbally instead of
Sure.
doing it here. So you've mentioned text messages a couple of times, and one of the things that's been a wish for me is to be able to send text message reminders to patients and to perhaps communicate with them a little bit for their appointments. We have a lot of difficulty with no-shows because we're talking about teenagers. And they communicate through text, and I have no way of doing that right now. So I'm just wondering if your platform could do that.
Yes, that's exactly what it does. Chris.
Yes. Back recording here, or back on so we have the send mode here. We can send both email only, or phone. So this would allow you to send out group of text messages. If there's an email in the system, it would do both. So you can select that. The content here in the email this is a reminder, upcoming schedule. We can also send along some links as well too, if there's any additional information that needs to go along with it. But yes, this is part of the platform.
Thanks for confirming. That's fantastic.
You're welcome.
Right. Well, some excellent questions, for sure. If there are no others, we can wrap up and be sure to share this recording and make sure everybody has my contact information. And we would love to find a way to work together, and let us know any other questions or how we can make that happen.
Yep, and I will send out the recording as soon as I get it, and I'll relay Nancy's information and all that good stuff.
Excellent. Well, thank you everyone for your time, your attention, and your great questions. We really, really appreciate it. I hope that you all have a great rest of the day.
Wonderful. Thank you so much.
Thank you. Bye-bye.